Don't watch this alone, you have been warned. A woman wakes up in the middle of the night. The room is dark, the house silent. She opens her eyes and feels pressure on her throat. Her own hand, her left hand, is wrapped around her neck, squeezing. She is fully awake. She did not choose to do this, and she cannot make it stop. This is not a scene from a horror film. This is a real, documented neurological condition called alien hand syndrome, sometimes known, almost too fittingly, as Dr. Strangelove syndrome. And the people who live with it describe something almost impossible to imagine, a hand that belongs to their body, but answers to no one. Picture a hospital recovery room, weeks after a major brain surgery. A man lies in bed, calm, recovering well by every measure his doctors can see. Then his left hand rises on its own. It reaches toward the water glass on the table beside him. He didn't move it. He watches it happen, the same way you'd watch someone else's hand move. Alien hand syndrome most commonly appears after a specific kind of brain surgery, a corpus callosotomy, where surgeons sever the corpus callosum, the thick bundle of nerve fibers connecting the brain's two hemispheres. This procedure is sometimes used to treat severe, otherwise untreatable epilepsy, stopping seizures from spreading between the two sides of the brain. But severing that connection comes with an extraordinary cost. The two hemispheres of the brain, no longer able to communicate directly, can begin operating independently, and in some documented cases, one hand starts acting on intentions the conscious mind never approved. Imagine reaching for a door handle with your right hand, only to have your left hand suddenly slap it away. Imagine buttoning a shirt with one hand, while the other hand, without permission, starts unbuttoning it again. These aren't hypothetical examples. They are documented behaviors recorded in patients with this condition, what neurologists call intermanual conflict, where the two hands appear to be working against each other, controlled by two halves of a brain no longer talking to one another. In one well-documented case, a woman recovering from callosotomy surgery found that her left hand would reach out and grab objects on its own, once closing around a kitchen knife while she was preparing food, requiring her right hand to physically restrain it. A quiet kitchen, afternoon light through the window. A woman stands at the counter, right hand gripping her left wrist tightly, holding it down against her side. Her expression is calm, practiced. This is something she has had to manage every day since her surgery. Neurologists describe this condition along clear diagnostic lines. There are two defining features. First, the patient experiences and reports a feeling that the limb is foreign, not truly theirs, despite being attached to their own body. Second, the limb performs complex, purposeful-looking movements that the patient did not consciously initiate and often cannot stop once they begin. This isn't a tremor, it isn't a tic. The alien hand can reach for specific objects, manipulate them with precision, and even appear to have its own goals. Goals the rest of the patient's body and mind never agreed to. Not every case follows brain surgery. Alien hand syndrome has also been documented following strokes, particularly those affecting the corpus callosum, the parietal lobe, or the frontal regions of the brain. It has appeared in patients with brain tumors and certain degenerative neurological diseases. Each cause produces slightly different patterns. Some patients experience grasping behavior, where the alien hand compulsively takes hold of any object placed nearby. Others experience what's called callosal alien hand. There's also a frontal variant of this condition, typically following damage to the supplementary motor area and anterior cingulate cortex, regions involved in planning and initiating voluntary movement. In this variant, the alien hand tends to reach compulsively toward nearby objects, almost magnetically drawn to anything within range, rather than fighting against the other hand directly. Patients with this form often describe the sensation as their hand being pulled toward things, as though some external force, rather than their own mind, were directing it. Doctors studying these variants have found that the location of the damage predicts, with remarkable consistency, exactly which behavior pattern will emerge, suggesting these aren't random malfunctions but specific, almost mechanical failures of particular control circuits within the brain. A close shot of two hands on a table, one resting calmly, fingers still, the other twitching faintly. One of the most striking documented cases involved a patient whose left hand, completely independent of her wishes, would unbutton her blouse in public settings. She described feeling intense embarrassment and helplessness, fully aware of what her hand was doing, completely unable to stop it through willpower alone. The only method that consistently worked was physically restraining the hand with her other arm, or distracting it with an unrelated object to occupy its attention. That detail, that an unconscious hand can be distracted the way you might distract a child, is one of the strangest parts of this condition. The alien hand isn't simply malfunctioning. It behaves as though something resembling intention survives inside it. Researchers believe alien hand syndrome offers a rare, almost unsettling window into how the brain normally constructs the experience of free will. In a healthy brain, the feeling that I am choosing to move my hand is constructed by multiple brain regions working in constant communication. The supplementary motor area generating movement intentions, the parietal cortex confirming body ownership, the prefrontal cortex layering in conscious decision-making. When the connections between these regions are damaged or severed, movement can still occur, the motor pathways still work, but the sense of ownership and conscious authorship over that movement disappears entirely. In other words, the hand still moves because part of the brain still wants it to. The patient simply isn't the part making that decision anymore. A dim therapy room, a small table between a patient and a clinician. The patient's hand rests on the table, fingers occasionally twitching independently. The clinician gently places a comb nearby, testing whether the hand reaches for it unprompted. Treatment for alien hand syndrome remains limited, largely because there's no way to medically reverse a severed or damaged connection between brain hemispheres. Most management strategies are behavioral rather than pharmacological. Some occupational therapists have experimented with mirror-based retraining, encouraging patients to watch reflections of their unaffected hand performing simple tasks, while attempting to mentally recruit the affected hand into following along. What makes alien hand syndrome so difficult for patients to describe isn't just the physical symptom, it's the existential nature of what's happening. Most neurological conditions affect how the body moves or feels. This one challenges something deeper. Family members of patients describe a particular kind of grief around this condition. Not the grief of losing a loved one, but the strange grief of watching someone you love lose trust in their own body, piece by piece. Spouses have described learning to physically intervene. Researchers have also documented cases where patients develop a complicated emotional relationship with the affected limb itself, some giving it a nickname, others describing genuine resentment. One published case described a patient referring to her alien hand simply as the other one. This has been a real, documented neurological case. Every detail in this video is sourced from peer-reviewed medical literature and confirmed clinical case studies. Dark Diagnosis Files investigates the cases medicine still struggles to explain. Every Thursday and every Sunday. Subscribe. Your mind is stranger than you think. Somewhere right now, someone is holding their own hand still, just in case it decides to move on its own.